Hello, if you are wondering if you have knee osteoarthritis or not, I am going to go through in this video the top 11 common symptoms of knee osteoarthritis. And one of the reasons why this is so important is because there's not particularly a specific test you can take or a blood sample. There's not really anything that can tell you, yes, you definitively have it, or no, you don't. So usually what doctors and other healthcare professionals will do is they'll look at all of the symptoms you're having, and they'll also look at your x-ray or MRI or whatever image that you've had done. Then they'll kind of take that and conclude osteoarthritis depending on what you're showing. So typically in this long list of symptoms, if you have about 3 or 4 of these symptoms kind of happening at once, it likely could be knee osteoarthritis. Then from there, we can figure out ways that you can treat knee osteoarthritis, and you'll find lots of those resources on my YouTube channel. But let's go through these symptoms first, because you may say, oh, you know what, it makes total sense, I have osteoarthritis, or this explains some things. I'm also gonna throw in what you can do about them briefly for all of these, because it's one thing to know if you have osteoarthritis, but it's another, okay, I have it, now what can I do? So this is off of a blog post that I've actually written as well, and I'm going to put the link down below. So if you prefer to read after the video, go to that blog post. Okay, so 11 common symptoms of knee arthritis. So I'm a physical therapist. I almost exclusively see people that have knee osteoarthritis and hip osteoarthritis, along with some other joints as well. One of the most common symptoms of knee osteoarthritis is stiffness. And this stiffness primarily happens in the morning. So when you wake up, your joint feels really stiff. You feel like you might have to hobble for the first couple of steps, or after you're sitting in a position for a prolonged period of time. So a lot of times this is sitting or laying down for at least, 1 to 2 hours. The onset of stiffness can depend, so you may have to sit or lie down or even just stand in one position for up to 2 to 3 hours before you feel the stiffness. Other people, you can be standing or sitting or in one position for 15 minutes and start to feel those symptoms. But if you wake up and you feel that stiffness, but then it typically tends to dissipate after about 30 minutes of getting up and moving around. Same thing if you're in a prolonged position and you get up, it usually starts to dissipate after about 30 minutes. If it sticks around for a little bit longer, it could indicate potentially rheumatoid arthritis. But if it tends to go away, then it can be one of the signs of osteoarthritis. What can you do about it? Well, especially in the morning, there are very simple exercises you can do just sitting on the edge of the bed or even laying down before you even get up to a sitting position. The movement really helps to lubricate the joint and gets that blood flowing. I have a video here that can give you just a few simple ways to get started, because a lot of times these are super simple, but movement can be very, very powerful in this situation. Number 2 is a gradual onset of knee pain. So this isn't typically like you have an injury and then you have pain. A lot of times it comes from just gradual pain that starts to increase in severity a little bit. Maybe it's just not going away. Seems a little bit more gradual than all of a sudden you have a ton of pain. Usually knee osteoarthritis isn't tied to a particular injury. You could have a degenerative meniscus tear, or you could have, ACL, MCL, the ligaments in the knee. If you do notice this rapid onset of pain, it likely could be something else. But sometimes people do feel like osteoarthritis pain comes from nowhere. But a lot of the times it's tied to, oh yeah, I guess if I think back about it, my knee has been hurting for, the past couple of weeks or the past month, and it's just kind of finally starting to get worse and worse. So a lot of times osteoarthritis is a gradual onset of pain versus just one rapid situation where you have pain. Now, this gradual onset of pain is likely from an asymmetry where maybe one side is weaker than the other, or you have certain muscles that are weaker on one side than the other. this kind of gradually starts to build up to the point where then all of a sudden you start to notice the pain. So it's definitely addressing those asymmetries and really figuring out, if you need to work on strength or if you need to work on balance or, those types of things. So it's starting out by getting an assessment, whether it's from a physical therapist or a movement expert, someone that can kind of help you pinpoint where those asymmetries are so you can tackle the pain, because the earlier, the better. So you want to get started on that right away and try not to just ignore the pain and hoping it goes away. Okay. Number 3 is feelings of instability, where you don't feel very confident, especially putting all of your weight on one side. And you may notice in some instances where it gets to the point where you start to notice that it gives out on you and it kind of buckles a little bit. Some people do experience that. Some people do actually just experience it kind of feels like it's going to do that, but it never actually does. Sometimes you can have some instability in your kneecap or your patella as well. These signs of instability can be in part of osteoarthritis, because a lot of times if you're dealing with osteoarthritis and you're dealing with pain, you don't move as frequently and you're just a little bit more hesitant to move. Instability can stem from muscle weakness and just not using it. So kind of that use it or lose it mentality with muscles. If we're not moving enough or if we're kind of giving up certain activities that we typically do, you may notice instability. Pain can also inhibit some muscle, the way the muscles work. Swelling can also do that as well. And we'll get to swelling in a second, but if you do notice knee swelling, it can lead to some instability because those muscles aren't able to work as they should or as efficiently. So if you do notice knee instability, exercise and strengthening is one of the most important things. You just have to make sure that you're doing the right things. Now, it does take a little while for strength to build up. So I actually have a blog post here that goes over my top 11 knee compression sleeves. They're those neoprene soft sleeves. They make your joint feel like you're getting a hug and can dramatically help with instability. Now, obviously, this is going to be more of a band-aid on the situation. So as you're working on strength to really build up that stability, you can use knee compression sleeves to help immediately with that stability as you're building strength. The fourth one is one of the most troublesome and the one that most people seem to be the most worried about, and that is knee noises. So if you're feeling like your knees are making crunching, cracking, creaking, all of these kind of foreign noises, this could be a sign of knee osteoarthritis. Again, it could be a couple of other things. So there's another type of arthritis that's called patellofemoral arthritis, and that just means arthritis of the kneecap. But it's essentially kind of treated pretty similar to knee osteoarthritis. But knee noises, the research is kind of out as far as, what exactly is causing it. But a lot of times it can stem from the instability and the weakness, because then now your kneecap in particular tends to kind of get out of the groove that it's in because it doesn't have enough support to keep it there. So sometimes it can be called, patella maltracking, where it's just not tracking as well in that nice little groove. And so when it kind of off-roads a little bit, that can cause some pain or some noises. Or if you have swelling, you may notice more of those noises. A lot of times these noises can be in squatting and going up and down stairs, really when you're kind of loading a bent knee. They're not necessarily troublesome if you do notice them unless they're associated with pain. But one of the things you can do if you notice them is actually really kind of start to, again, work on the strengthening part and work on moving optimally. Because we want to keep that patella or that kneecap in that groove, and the best way to do that is actually by using your own muscles. Sometimes the compression sleeve may help to reduce some of those noises, but it's one of those things that it's a sign of knee osteoarthritis, but it's not necessarily something that you should be worried about. A lot of noises are normal and they're not necessarily pathological, but by improving the way you move, it can help to reduce some of those noises. Number 5 is pressure or pain when you're climbing the stairs. So if you kind of notice, along with that gradual pain that you can't necessarily tie it to an injury or something like that, but all of a sudden you kind of start to notice that stairs are becoming harder and you feel a lot of pain. This could be a sign of knee osteoarthritis because this is one of the biggest things that people have difficulty with when it comes to stairs. Now again, just because you have problems with stairs does not particularly mean that you automatically have osteoarthritis. Remember, we want to kind of look at a cluster of these symptoms. So you want to have about 3 or 4 to kind of consistently point you in that direction. If you have pain or pressure climbing the stairs, it could be for a variety of reasons, but likely either your muscles are tight because they're making up for a weakness somewhere else. This can lead to more pressure on the patella or the kneecap because as you bend that knee and put your weight through it, those muscles are really kind of pulling on that kneecap, kind of forcing it into that groove. Also, if we don't have a lot of strength on one leg and you try to bring yourself up on the stairs or control yourself going down, your body relies much more on the joint and the joint has to take a lot more stress. Now, if you have appropriate strength, then the muscles help to absorb some of that stress. So again, it kind of turns to that strengthening, but also I've noticed that improving your balance can dramatically impact your ability to climb up and down stairs. So looking at, again, strength and balance and pointing back to the compression sleeve can help to give you a little bit of relief immediately, as again, strength and balance do take a little while to build up. But it's essentially kind of teaching your body to move well and to move how it should be to decrease the irritation from those joints. Difficulty squatting. So this kind of goes into the last time we talked to number 5. Difficulty squatting. If squatting starts to become awkward or it starts to become painful, this could be a sign of knee arthritis. But again, it could be signs of, other things, just knee injuries in general. But difficulty squatting can be so important because it's so vital for life. You have to be able to squat. And if you feel like you don't have the right mobility, if you feel pain, if you just feel like you're scared to even do it, then this can be a sign of knee osteoarthritis. And so what can you do about it? Well, there are lots of different ways that we can modify squats. Even people that come to me that have very severe knee arthritis, they're bone on bone, it is possible to squat without pain. But you have to do the right variation. So you're essentially trying to find a way that you can train your body to squat without flaring up your pain. I do have a video here of the 10 modifications that I typically use with patients depending on where they're at the knee arthritis scale, whether it's pretty mild or it's severe. But these can be really helpful to find one that works for you. There are lots of things you can do, but squatting is absolutely imperative. You need to know how to do it. And so head to that video just so you can see different ways you can try that don't aggravate your knees. Okay, number 7 is the fluctuation of the swelling. So if you're noticing knee swelling, and sometimes it appears to kind of be spontaneous, like all of a sudden you notice your knee swollen, and then it may go away, and then it may come back after a couple of days. This can be a sign of knee arthritis. It is common to have swelling, but you don't always have to have swelling. So if you don't have any swelling, it doesn't particularly mean you don't have it. I do have lots of different people who don't necessarily experience much swelling or may like on a less frequent schedule. But one of the things when you start to notice knee swelling is see if you can tie it to something that you've done. Because once you can see what maybe can flare that swelling up, then we can start to work back as far as how to control it. So for example, one of the clients I had, she would notice knee swelling after walking over a mile. So whenever she would go further than a mile, she would come back and likely experience pain, but also swelling. So then we take it from there. we keep her walking under a mile to start with, so she can kind of gradually start to build up. But then we add in some other exercises and some other movements outside of moving forward that can help to strengthen. So we move sideways, we move backwards. There's all kinds of different things. So we're not necessarily taking away exercise. We're just adding in a couple of other things and shortening that walk, because that seemed to be one of the things that she tied her swelling to. And then she started to notice less swelling. So if you think about, there's not always, a glaring reason why, but if you just kind of backtrack and start to think about, maybe it's certain foods, or maybe it's when you don't sleep very well, you notice swelling, or doing a certain movement. So if you just kind of think about what you can maybe tie your swelling to, then that can be helpful as far as moving forward and figuring out how to reduce it. Number 8 is if you're feeling off balance. If you are usually one of those people that, maybe you played sports, or, you've always been active and you've always had pretty good balance, but now all of a sudden you're not feeling as stable. Not necessarily that you're falling all the time, but you just don't feel as confident on one leg or even both legs. Maybe you have had a history of a fall. This can actually be tied to knee arthritis. So as far as improving it is working on balance and working on strength in ways that aren't going to cause pain. And it's important to know that if you have knee osteoarthritis, you just have to exercise a little bit differently in the beginning, just so we're not flaring up the pain. So if you're feeling off balance, there's tons and tons of balance things to do. And if you notice that you're starting to move less, maybe because you have pain or it just feels harder to move, then your balance will decline. And if we're not necessarily being conscious about working balance, then it can decline as well. So just adding a few simple things. I have a video here that just gives you some very simple things on how to work on your balance, because it can be very, very effective, and it can help to actually relieve your knee pain while helping you improve your confidence and move around easier. Loss of flexibility is number 9. So if you notice that your knee is not bending very well, maybe you can't get it all the way straight. These are 2 common ways or 2 common symptoms of knee arthritis. You start to maybe lose the ability to bend, and you start to lose the ability to straighten. Now, these are 2 incredibly important things that you need to be able to do. You may notice limping if you can't straighten your leg all the way. If you can't bend it all the way, stairs may become hard. Even sometimes walking can become hard. So when you start to notice this, it's so important to take action early to get that range of motion back, because it is usually possible to regain that range of motion, but you have to be able to know what to do and to realize that you may be losing some of that range of motion. So looking to see if you can straighten, if you can bend your knee. If you can't, that's okay. It could be a sign of knee osteoarthritis, but there are things we can do for it. And one of the things is simply just working on bending and straightening, because the more that we kind of move into that position, our muscles tend to get a little bit more used to that position. So on a very superficial level, just simply working on bending and straightening can be very powerful to help maintain your range of motion. Okay, so number 10 is pain on one side. So if you notice that this kind of gradual onset pain starts to happen maybe on the right side first, then it can spread to the left, but it's usually not at the same time. If you notice that maybe both knees, kind of all of a sudden they're painful, they're swollen, maybe they're even a little red, this can actually be a sign of rheumatoid arthritis that typically is more symmetrical, that typically affects both sides. I have a blog post here that goes over the difference between osteoarthritis and rheumatoid arthritis. They're treated a little bit differently, so that's why it's important to know the difference. But typically, pain starts on one side and can move over. In order to address this, pain typically comes from an asymmetry. So think about like if you've had, a past ankle injury, or you've had a past knee or hip injury, even a back pain problem. Maybe it's changed kind of the way you move, and one side might be stronger than the other. In these certain circumstances where you're asymmetrical, that one side is stronger than the other, this can lead to pain just because you can be compensating in different ways, you can be moving in different ways. And so ideally with the treatment, we want to kind of close the gap between the two sides. So we want to make you as symmetrical as possible. It's not always going to be perfect, but if we can start to build up maybe that weaker side or start to address some of these deficits, then you'll start to notice pain reduction if you're focusing on the right things. Okay. Pain flare-ups is number 11. So this is kind of an intermittent flare-up where you have a lot of pain and then it kind of reduces, and then you have a lot of pain and then it reduces. So this is a common scenario for flare-ups. And what a flare-up is just kind of it can range in time. So it can just be a few hours, or it can, stretch to 3 to 4 days depending on what triggered it. But essentially you have something that triggers it and you start to experience pain. You might experience swelling, you might experience more stiffness. And then typically it relieves in a shorter amount of time. This can be triggered by a lot of different things. It can be stress, it can be poor sleep, it can be, eating inflammatory foods. It can be even certain types of movement. Even doing too much can set or trigger a flare-up. And it's important, again, kind of like the swelling, to look back. If you're like, man, all of a sudden I have all this pain, what gives? Think about maybe what you've done in the past couple of days. Think about maybe what has been different than like your typical routine. Maybe you walked a longer distance, or maybe you ate out 3 times last week instead of just the normal, 1, or what can you tie it to? What has changed? This way, then you can kind of figure out if you need to reduce something, if you need to change something, or if you just need to be a little bit more cognizant so you can prevent these further flare-ups. Now, sometimes it can be the weather, sometimes it can be something that's out of your control. And if this is the case, one of the things that I really like to prepare patients with is just by having a couple of tools you can use for pain relief. So like if you have like a pain relieving cream, or if you have if you can go get a massage, if you can just lightly massage your knee yourself, you can use a compression sleeve. All of these things can help to mitigate pain almost immediately. And I do have a video here that has just 5 strategies you can use to kind of find that immediate pain relief. Even just some gentle movement can be really helpful when you're in a flare-up. But having some of these things so that you know that if you start to experience higher levels of pain, you have ways that you can work around it and at least reduce it to the point where you can take the edge off so you're not miserable for the duration of this flare-up. So looking at these 11 symptoms, if you have at least 3 or 4 of these symptoms, then it kind of starts fitting together like a puzzle. You may have knee osteoarthritis. But if you do, I don't want you to freak out. This also can be accompanied with an X-ray or an MRI. But if you have it, there are absolutely ways that you can reduce the pain, you can prevent most of the progression, you can get your symptoms to kind of come at a normal level so that you're not necessarily struggling all day, every day, or seeing your mobility diminish. So you can still lead an active life with osteoarthritis. And I do have a free guide down below. You'll find the link of where to get started. So this guide has the best resources to get started on your journey to finding knee osteoarthritis pain relief. So that link is going to be down below. The guide's totally free because I want to give you the best resources to handle osteoarthritis, because if you search online and if you talk to doctors or if you talk to other medical professionals, you may feel a lot of negativity. And that's why I am glad you're here right now watching this, so we can prevent that and I can show you that you can adventure with knee osteoarthritis. Hope this was helpful. If it was, go ahead and hit that red subscribe button down below. And I cannot wait to see you in the next episode.